Cataracts, yes. An estimate of something like over 60.5 million people. I'm telling you, goodness, out of something like 8.4 billion persons on the globe. Now, this week we're creating awareness because it is the Glaucoma Week, and the theme is Uniting for Glaucoma and a Free World. So we're going to be diving into it. I want to get this right, but Dr. Abubakar Karinaki here is an ophthalmologist. Did I get it right?
Ophthalmologist.
Okay, that one.
It's simple as eye specialist.
Okay. Thanks for joining us, Doctor, once again.
Thank you very much.
And we want to thank God for the holy month is already in, course, and I know you're very...
You're fasting, Ramadan.
Exactly, fantastic. So to the Muslim world, our dear brothers and sisters, thank you so much, and we pray that God will bless you as you continue in the fasting. Doctor, what is glaucoma, for starters?
Yeah, thank you very much. It's a pleasure being here for this program. Not being my first time to be hosted here. Glaucoma is a blinding disease. You know, we have to tackle those very strong words. A blinding disease. As you said,
it's scary.
Second leading cause of blindness worldwide. It's a disease that affects the nerve that helps us to see. So if you talk about glaucoma, it's a disease of the eye, but affects the nerve that transmits light rays to the brain.
Wow.
So dear viewers, it's our brain that sees. So the nerve that transmits the information, if it gets damaged, then you cannot see well. So that's glaucoma.
Then I would ask a question. Why are we really creating more awareness?
Yeah, this is very important. You know, before I answer that, we call glaucoma the silent thief of our sight. Silent thief. By the time you know that you're blind from glaucoma, it has been on for some years. So it's an issue, and we have to create awareness, because you can't know that you're getting blind until you're blind.
Seriously?
So this awareness campaign is very important for every one of us.
Wow. Now, of course, with this thief of blindness, or this blind thief, what could be the causes? Because once we know that, we are out of the chariot that can lead us to blindness.
Yeah, thank you. Everyone should be concerned. What causes glaucoma? We know about cataracts. Everyone knows about cataracts.
Yes.
Senke. And we know the cause of cataracts. One of the major risk factors is aging. If someone grows older, they stand chances of getting cataracts.
Yes.
Now, glaucoma, we can't talk about causes of glaucoma, but we can simply say who is at risk of developing glaucoma.
Okay.
That's very important.
Yes, sir.
Glaucoma has risk factors. One of the main risk factor for developing glaucoma is being an African.
That?
If you're an African, you stand high chances of developing glaucoma. Of course, the commonest type is what we call open angle glaucoma. In Asian countries, we have what we call closed angle glaucoma, but open angle glaucoma is the commonest. Being an African means you stand high chances of developing and getting blind from glaucoma. Other factors are aging.
Okay.
If you're above 35, 40 years and above, the more you grow, the more you advance in age, the chances of developing glaucoma increase. The other important risk factor that I should tell our viewers is family history of blindness.
Yes.
We say family history of blindness because our ancestors, our uncles, our grannies, most of them never had access to eye health care, and they happened to get blind. So we don't know if it was due to glaucoma or to any other issues, but we think if someone is blind, the chances are high that it's due to glaucoma. You've heard of someone is blind in a village, no one can accept to go blind until they try their best to see that they can regain their sight. If someone is declared blind permanently, 90% due to glaucoma.
What?
Especially for someone who has been seeing well since childhood, and then when they get old, they are blind. So family history of blindness, if you're viewing us and you have an uncle, you have an auntie, you have a father
who wear specs,
who were blind.
Okay.
You stand,
not who wear specs. Okay.
Of course, someone with specs, I think they have correction for their visual impairment.
Okay.
But someone who is blind, they can't see, even if they have specs on, they cannot see well. So if you have a grandfather, an uncle, who was declared blind, you also stand chances of having glaucoma.
So, in other words, if someone is declared blind,